Have you ever wondered why the current virus situation in America seems to be a never-ending cycle? It's a question that many of us find ourselves asking, especially in recent times. So let's take a deep dive into the current virus situation in the country. There's been a noticeable increase in cases, particularly amongst the youth. A major contributing factor to this surge appears to be extracurricular activities, especially youth sports. Health officials have linked clusters of cases to high school wrestling tournaments in Florida and youth sport activities in Minnesota. But it's not just about the increase in cases. The virus isn't static, it evolves. And one variant in particular, known as B1.7, has been causing concern. This variant is more transmissible, which means it can spread more easily from person to person. It's been identified in these clusters linked to youth sports, making the situation even more complex. Dr. Anthony Fauci, a familiar face in the fight against the virus, has warned that team sports without masks are driving the spread of the virus among children. He also emphasized that informal settings like after-school activities may pose a higher risk of transmission. The situation is fluid and constantly changing, which is why it's so important for parents to stay informed about sports league protocols and remain vigilant as COVID-19 variants evolve. It's not just about protecting our children, but also about breaking the cycle of transmission in our communities. Clearly, the virus continues to be a significant challenge, particularly with the emergence of more transmissible variants. One may ask, what factors contribute to the risk of contracting this virus? Well, there are several risk factors that can increase the likelihood of infection. High-risk environments play a significant role. Take youth sports and other extracurricular activities, for instance. These settings have shown to contribute to the spread of the virus among children. Clusters of cases have been linked to high school wrestling tournaments and other youth sport activities. Why are these environments considered high risk? It's because they often involve close contact, heavy breathing, and shared equipment, creating a perfect storm for transmission. Moreover, these activities often take place in informal settings, which may not adhere strictly to preventive measures. Now let's talk about a game changer, the B1.7 variant. This variant of the virus is more transmissible, meaning it can spread more easily and quickly. It has been identified in several clusters linked to youth sports. The presence of such variants adds another layer of risk, making it even more crucial to be vigilant. Another key factor to consider is geographic location. Areas with higher infection rates pose a greater risk. This is why it is important to stay informed about the situation in your local area and adjust your actions accordingly. Finally, personal health and age can influence the risk as well. Individuals with underlying health conditions and the elderly are more susceptible to severe outcomes if infected. It's important to note that these risk factors are not exhaustive, and the situation continues to evolve as we learn more about this virus. We must stay informed and adaptable, taking into account new information as it becomes available. Understanding these risk factors is the first step towards protecting ourselves and our loved ones. What are the telltale signs that someone might have contracted the virus? Well, this virus, like many others, can manifest in a variety of ways. However, there are a handful of common symptoms that one should be particularly aware of. Firstly, a high temperature or fever is a clear sign that your body is fighting off something. This is often accompanied by a persistent cough, which may be more severe than your typical winter cough. Another symptom to watch out for is a noticeable change in your sense of taste or smell. This has been highlighted as a particularly unique symptom of this virus. Some individuals may also experience a sore throat, aches and pains, or a headache. While these are the most common signs, it's important to note that some people may experience additional symptoms such as fatigue, a rash on skin, or a color change on fingers or toes. In more severe cases, individuals might struggle with shortness of breath or difficulty breathing. Now, it's crucial to remember that these symptoms can also be common to other illnesses. So if you're feeling under the weather, don't panic. However, if you do experience these symptoms, it's important to get tested. In fact, testing is the only definitive way to know if you've contracted the virus. And remember, even if you're feeling healthy, you could still be carrying the virus and unknowingly spreading it to others. Hence, it's always a good idea to err on the side of caution. If you've been in close contact with someone who's tested positive, or if you've traveled to a high-risk area recently, consider getting tested. Early detection is key, so stay vigilant and seek medical attention if you or a loved one exhibit these symptoms. So what happens if someone gets infected? What are the treatment options? If someone contracts the virus, the treatment methods will vary based on the severity of the symptoms. For those with mild symptoms, home care is the primary course of action. This includes rest, hydration, and over-the-counter medications to relieve symptoms. It's also crucial that the person stays isolated to prevent the spread of the virus to others. In more severe cases, hospital care may be required. This could involve supplemental oxygen, antiviral medications, or in extreme cases, the use of a ventilator. The primary goal of these treatments is to support the body while it fights off the virus. It's important to remember that these treatments are not cures, but supportive measures that can help to manage and mitigate symptoms. Now you may be wondering about vaccines. Vaccines play a pivotal role in the fight against the virus, not in treating an existing infection, but in preventing severe disease in the first place. Vaccines work by teaching our immune systems how to recognize and fight the virus. They have proven to be highly effective in reducing the severity of the disease and hospitalizations. However, it's important to note that even with vaccination, it's still possible to contract the virus, although the chances of severe disease are significantly lower. This is why continuing to follow safety measures like wearing masks and social distancing remains important even after vaccination. While we have several treatment options, it's clear that they are primarily aimed at managing symptoms and supporting the body's natural defense system. Unfortunately, there's no magic bullet that can cure the virus instantly. This is why prevention is so crucial. While treatment methods continue to evolve, prevention remains our best defense against this virus. Prevention is better than cure, so how can we reduce our risk of contracting the virus? The first line of defense is wearing masks. Masks act as a simple barrier to help prevent respiratory droplets from traveling into the air and onto other people when the person wearing the mask coughs, sneezes, talks, or raises their voice. This is called source control. Next, we have social distancing. This involves maintaining a distance of at least 6 feet from others when you're in a public place. When people are close together, they can breathe in the respiratory droplets containing the virus, leading to infection. Another crucial prevention method is washing hands. Regularly and thoroughly clean your hands with soap and water for at least 20 seconds. This eliminates germs, including the virus that may be on your hands. Avoiding crowded places is also important. The more people you are in contact with, the more likely you are to be exposed to the virus. Last but not least, getting vaccinated is crucial. Vaccines work with your immune system, so it will be ready to fight the virus if you are exposed. By practicing these prevention methods, we can protect ourselves and others from the virus. In summary, the current virus situation in America continues to be a significant challenge. We've delved into the risk factors, such as participation in youth sports and extracurricular activities, which have been linked to clusters of cases. We've also highlighted the signs and symptoms to look out for, including those associated with the more transmissible B.1.7 variant. We've explored the available treatment methods, underscoring the importance of a robust healthcare system. We've also discussed prevention methods with a focus on following guidelines recommended by health officials, such as limiting participation in youth sports and staying informed about sports league protocols. And let's not forget the role of vaccines in combating this virus and the disparities in vaccination rates across different regions. The situation is fluid, with new developments emerging as the virus and its variants evolve. Stay informed, stay vigilant, and stay safe. Together we can overcome this challenge.